Let us understand about the attached gingiva. Attached gingiva is continuous with the marginal gingiva. Attached gingiva is continuous with the marginal gingiva. This is the marginal gingiva. Attached gingiva is continuous with the marginal gingiva and it is an essential component of the masticatory mucosa. Now, let us explore its characteristics and clinical significance step by step. So, let us understand about the characteristics of the attached gingiva first. Attached gingiva is firm and it is resilient. Here resilient means it can spring back to the original shape when the pressure is applied. This resiliency is because of the collagen fibers which are present in the connective tissue. Attached gingiva is tightly bound to the periosteum of the alveolar bone. What is periosteum of the alveolar bone? Attached gingiva is bound to the periosteum of the alveolar bone. So what do you mean by periosteum? Periosteum is the outer covering of the bone. So this is the alveolar bone. So outer covering of the alveolar bone is known as periosteum. So this periosteum is made up of dense fibrous connective tissue. Collagen fibers which are present in the connective tissue of the attached gingiva are tightly bound to the periosteum. This binding is helping the attached gingiva to withstand the mechanical forces during the mastication and brushing. Attached gingiva is an immovable tissue, whereas alveolar mucosa is relatively movable. Attached gingiva is immovable, offering stability to the soft tissues of the oral cavity. The line which is separating the attached gingiva and alveolar mucosa, as already mentioned, it is known as mucogingival junction. Now, let us discuss the width of the attached gingiva, which is an important clinical parameter. What is the width of the attached gingiva? It is the distance between the mucogingival junction, which is stationary throughout the life, and the projection on the external surface of the bottom of the gingival sulcus. So this is the bottom of the gingival sulcus. You can see a projection on the bottom of gingival sulcus. So from there till the mucogingival junction is the attached gingiva. Let us understand the difference between the width of the attached gingiva and width of the keratinized gingiva. Width of the attached gingiva is not including the marginal gingiva. It is from the external projection of the base of the sulcus to the mucogingival junction. That is attached gingiva. Whereas width of the keratinized gingiva is including the marginal gingiva. So from here to here is the width of the keratinized tissue. This tissue width is including the attached gingiva plus marginal gingiva. Let us see the dimensions in different areas. So the width of attached gingiva is varying across different areas of the mouth. In the maxillary incisor area, the width of the attached gingiva is 3.5 to 4.5 mm. In the mandible, it is 3.3 to 3.9 mm. That is near the mandibular incisors. So in the premolar areas, you see the narrower width of the attached gingiva. It is 1.9 mm in the maxilla, and in the mandible it is 1.8 mm. Near the first premolars. This measurement is near the first premolars. Now let us understand how the width of the attached gingiva is measured in different scenarios. In healthy periodontium, attached gingiva is measured from the base of the sulcus to the mucogingival junction. So this measurement is reflecting the true width of the attached gingiva. When you are trying to understand the width of the attached gingiva, it is important to know about the biological width. The new term for the biological width is the supracrestal attachment. The supracrestal attachment includes two components, junctional epithelium and the connective tissue attachment. The junctional epithelial component of biological width or the supracrestal attachment is attaching to the tooth, and the connective tissue is getting attached to the tooth and also to the bone. So while calculating the attached gingiva, it is important to understand the supracrestal attachment. So whereas in the periodontal disease, junctional epithelium is migrating apically and the base of the sulcus is no longer a stable reference point. So here the sulcus is including the inflamed connective tissue and also the pocket epithelium. These two are not a part of the attached gingiva. In such cases, we do not use the sulcus as the reference point. Instead of the sulcus, in order to measure the attached gingiva, we are using the crest of the alveolar bone as the stable reference point. In periodontal diseases, we are using the crest of the alveolar bone as a stable reference point. The distance from the crest of the alveolar bone to the mucogingival junction is giving the width of the attached gingiva. This is the true measurement of the attached gingiva in the deceased cases. When you calculate this, the attached gingiva can be present or it may be absent. So alveolar bone crest is a stable reference point even in the periodontal disease. So here we are taking the mucogingival junction as the second reference point. First reference point in the periodontal disease is the crest of alveolar bone, and the second reference point is the mucogingival junction. So, mucogingival junction is a stable reference point throughout the life. So here we are taking the mucogingival junction as the second reference point. So one last point to note is mucogingival junction is stationary throughout the life, which makes it reliable landmark for the measurements. Width of the attached gingiva can change with the age or conditions like supraeruption. If you found this video helpful, hit the bell icon below and subscribe to my channel, and stay tuned to Tooth Fairy Tales for more dental videos.